Hello students, welcome to this session. Today we are going to study endocrine system.
Learning objectives are 7 endocrine system. So 7.1 is structure of pituitary, thyroid, parathyroid, adrenal, pancreas glands, and then 7.2 are the syndromes resulting because of the hypo or hyperactivity of the glands.
So what is exocrine gland? So there are two types of glands. So exocrine gland, the gland which releases their secretions into the duct, they are called as exocrine glands. Example, pancreatic gland or gastric glands. Then endocrine gland, the gland which releases their secretion called hormone into the blood directly without duct, they are called as ductless glands. So they are called as endocrine glands, and the hormone is a secretion of endocrine glands. The hormones, they are secreted in small amount, released directly into the blood, and then carried to the target organ through the blood, and they are specific in action. So first is the pituitary gland. So pituitary gland is located in the brain on the floor of the cranium. It lies in the sphenoid bone of the skull, and it is called as master endocrine gland because it controls all other glands by its secretions. Then there are two parts of the pituitary gland, that is anterior pituitary gland and posterior pituitary gland. So anterior is called as adenohypophysis and posterior is called as neurohypophysis because it secretes neurosecretory hormones. Now we will see hormones secreted by pituitary gland. So first is the anterior pituitary gland. So it secretes the hormone thyrotropin, which acts on a thyroid gland. ACTH, that is adrenocorticotropic hormone, it acts on an adrenal gland. It is present above the renal gland. It is also called as suprarenal gland. Then other hormones for the ovaries and testes are gonadotropins, then FSH, LH, prolactin, then growth hormone, then somatotropin, which promotes the growth of the whole body. Then posterior pituitary gland secretes two hormones, mainly ADH, that is antidiuretic hormone, also called as vasopressin. It is mainly required for the water reabsorption by acting on the kidney. And second is the oxytocin, which allows uterus contraction in a labor. Now next gland, important gland, is the thyroid gland. So it is present in the neck just below the larynx or Adam's apple in the males, and it consists of two lobes on either side of the trachea. The hormones secreted by thyroid gland, they are T3 and T4. T4 is also called as thyroxine, and the main function of the hormone secreted by thyroid gland, T3, T4, to control body metabolism energy release in the mitochondria, and it influences the growth and central nervous system growth mainly in the newborn babies. Fifth gland is the parathyroid gland. They are 4 in number and they located in each pair at the back side of the thyroid gland. The hormone secreted by parathyroid gland is parathormone or PTH, and it is regulation for the calcium ions. The functions of the parathormone, they are acting as a hypercalcemic hormone. So it increases calcium level in the blood by bone demineralization, increase calcium reabsorption in renal tubules, and increase calcium from the digestion. Seventh gland is the pancreas. So it is leaf-shaped lobulated gland present in the C-shaped loop of the duodenum. It has 4 parts: head, neck, body and tail. And the exocrine portion, that is pancreatic duct, opens into the duodenum along with the bile duct. The functions of the pancreatic gland, so it is a mixed gland, that means it has both functions, endocrine and exocrine. So exocrine part, they are acini, which secrete pancreatic juice, which is required for the digestion of the proteins mainly, and then it is carried, that is through the pancreatic duct, and which opens into the duodenum. Then endocrine part is called as the islets of the Langerhans. So it has 3-4 types of cells, like alpha cells which secrete glucagon. So it is a hyperglycemic hormone because of the gluconeogenesis. Beta cells secrete insulin which control blood sugar level. So it is hypoglycemic hormone by the glycogenesis. delta cells which secrete somatostatin, and PP cells secrete pancreatic polypeptide. The glucagon, that is secreted from the alpha cells, so they act on the hepatocytes, and it is a hyperglycemic hormone. So by the mechanism increases sugar like mechanism glycogenolysis, gluconeogenesis, and it reduces cellular glucose utilization, and in this way it increases the blood sugar. And then insulin secreted from the beta cells of the Langerhans, so it acts over the hepatocytes and adipocytes, that is fat cells, and it is a hypoglycemic hormone. So the mechanism is glycogenesis, that is conversion of glucose into the glycogen. Then it inhibits gluconeogenesis, and it increases cellular glucose utilization, and in this way it decreases the blood sugar in the blood. Eighth gland is the adrenal gland. So it is located in the above portion of the kidney and also called as suprarenal gland. So it is a triangular gland, each present over the superior surface of the kidney, and it has two parts, medulla and cortex. So cortex is the outside portion and medulla is the inner portion. So structure of the adrenal gland, so it has two parts, outer cortex and inner medulla. So cortex is a yellowish tissue surrounding the medulla, and it is stimulated by the pituitary hormone, that is ACTH, adrenocorticotropic hormone, to produce the adrenal gland hormones. So the layers of the cortex are three, that is outer layer is also called as zona glomerulosa, middle layer is zona fasciculata, and innermost layer is the zona reticularis. And then they secrete the adrenal gland hormones, also called as corticosteroid hormones. The medulla, it is a grey core of the gland. It consists mainly of the chromaffin tissue, and is stimulated by the sympathetic nervous system to produce hormones like epinephrine and norepinephrine, that is adrenaline and noradrenaline. So adrenal gland hormones, so the outer cortex, it has three layers. So outermost layer, that is zona glomerulosa, it secretes mineralocorticoids, that is aldosterone, and it helps in regulation of the minerals like sodium and potassium by the kidney, and excretion of the potassium and phosphate, and electrolyte balance, fluid balance, blood pressure control, and osmotic pressure control. Then zona fasciculata, it secretes glucocorticoid, that is cortisol or cortisone, and then it helps in the carbohydrate metabolism, that is glucose metabolism, inhibits cellular uptake and utilization of the amino acids. It is anti-inflammatory reaction and suppresses immune response and stimulates RBC production. Then the third layer is zona reticularis, so it secretes androgen, and it is mainly for the sexual characteristics, that is masculinization. Then adrenal medulla, it secretes the medullary hormone, that is catecholamines, so adrenaline, also called as epinephrine. So it has a function like increase heart rate, so it has a function for the fear, fight and flight. So increase heart rate, increase force of constriction of the heart, dilatation of coronary vessels and blood vessels supplied to skeletal muscles, pupillary dilatation, sweating, increase respiratory rate, breakdown of the glycogen and lipids and proteins. So these are the hormones secreted by adrenal medulla, that is adrenaline and non-adrenaline. So non-adrenaline stimulates sympathetic autonomous nervous system. Hello students, welcome to this session. Let's study endocrine system. So this is a summary of hormones and functions of the hormones secreted from the endocrine glands like pituitary, thyroid, parathyroid gland, adrenal gland, pancreas, ovary and testes. Increased growth hormone in childhood causes abnormal growth of body, and that is called as giantism. So in that, person will have very large hands and feet, thick toes and fingers, a prominent jaw and forehead, coarse facial features. Children with giantism may also have flat nose and large heads, lips and tongues.
Headaches, vision problem and excessive sweating is there, and then severe and recurrent headaches, weakness is there, insomnia and other sleep disorders may be there. There will be delayed puberty in both boys and girls, and irregular menstrual periods in girls, and maybe deafness is also there. Increased growth hormone in adult causes disfigurement of face, and it is called as acromegaly. The symptoms in adults are acromegaly affects bones and then tissues and causes them to grow in irregular way. So there will be enlarged hands and feet, changes of face shape including more prominent jaw and forehead, increase in size of lips, nose and tongue, excessive sweating or oily skin, deepening of voice, headache, joint pain, vision changes, increase in number of skin tags, numbness in hands, sleep apnea are the symptoms present in acromegaly. Posterior pituitary gland hormone is ADH, that is antidiuretic hormone, also called as vasopressin. So deficiency of ADH causes diabetes insipidus. So in that, the decreased water conservation, that is because of the diuresis, that is polyuria. So increased urination, that is called as diuresis, and because of that there will be water loss and there will be dehydration in that patient. Second gland is the thyroid gland, and in that disorder the first is goiter. So goiter is abnormal enlargement of the thyroid gland, and it is butterfly shaped gland located at the base of the neck just below the Adam's apple. So causes for the goiter can be iodine deficiency or autoimmune diseases like Graves' disease or Hashimoto's thyroiditis, hyperthyroidism or hypothyroidism. Then the symptoms are usually goiters are painless, but large goiter may cause cough and difficult to swallow or breathe because of the pressure effect. And the investigations are done, that is thyroid function test, to investigate the effect and cause of the goiter. Hypothyroidism, it is deficiency of thyroid hormones, that is low T3 and T4, and it is because of the mainly iodine deficiency. And the causes are genetic defect in the thyroid development, post surgery, radioiodine therapy or external radiation, autoimmune thyroidism, Hashimoto's thyroiditis or iodine deficiency. And the symptoms are the enlargement of the thyroid gland, then abnormal weight gain, low metabolic activity, then you can see in this picture dryness of the skin, high cholesterol level, poor concentration and memory, muscle weakness and generalized fatigue and unexplained weight gain. And the investigations done are T3 T4 decreased and TSH increased. The hypothyroidism in adults is called as myxedema, and hypothyroidism in infants is called as cretinism, and these two conditions we will see in detail in the coming slides. Cretinism, it is also because of the hypothyroidism in the infancy or early childhood. So the term cretin, meaning Christian or Christ-like, so it is applied to those who are unfortunate and they are so mentally retarded, so they are incapable of sinning. The cause is the severity of the mental impairment related to the time at which the thyroid deficiency occurs in utero. So normally T3 T4 crosses placenta and it is required for the fetal brain development. If there is maternal thyroid deficiency before the development of fetal thyroid gland, the mental retardation is severe. Clinically, there is big swollen protruded tongue, mouth is always open, low mental and physical activity, impaired development of skeletal and central nervous system. Because of that, there is mental retardation, short stature, then coarse facial features and umbilical hernia. And investigation of thyroid function test, T3 T4 are decreased and TSH, that is thyroid stimulating hormone, is increased. Myxedema, so it is hypothyroidism developed in the older child or the adult. Clinically, myxedema is marked by slowing of the physical and mental activity, generalized fatigue, apathy, mental sluggishness, and which may resemble to the depression. Speech and intellectual functions are slowed and they are listless, cold intolerant, so they cannot tolerate cold, Frequently they are overweight, constipation and decreased sweating is there. Skin is cool and pale because of the decreased blood flow, reduced cardiac output, and because of that shortness of the breath and decreased exercise capacity, broadening and coarsening of the facial features, enlargement of the tongue, deepening of the voice, tiredness, heavy menstrual bleeding in female, hair loss and slow heart rate. And then investigations of the thyroid function test, T3 T4 are decreased and TSH is increased. Hyperthyroidism, it is increased secretion of thyroid hormones. It is mostly because of the hyperfunction of the thyroid gland. And thyrotoxicosis is hypermetabolic state of the elevated levels of the T3 and T4. The causes of the hyperthyroidism: diffuse hyperplasia, also called as Graves' disease, or toxic multinodular goiter, toxic adenoma, iodine-induced hyperthyroidism, or neonatal thyrotoxicosis because of the maternal Graves' disease. And the symptoms are enlargement of the thyroid gland, weight loss, nervousness, fatigability, excessive sweating, increased body temperature, heart rate is increased, tremors, that is shaking of the hands, protrusion of eyeball, also called as exophthalmos, and because of that the eye is open and sometimes eye may become dry. And the investigations, T3 T4 are increased and TSH is decreased. Graves' disease, it is most common cause of hyperthyroidism, characterized by triad of the thyrotoxicosis, ophthalmopathy, that is exophthalmos, and dermopathy. The Graves' disease is an autoimmune disorder caused by the activation of thyroid epithelial cells by autoantibodies to the thyroid TSH receptor. The thyroid in Graves' disease is characterized by diffuse hypertrophy and hyperplasia of the follicles and lymphoid infiltrates. Investigations done, so in that elevation of the T3 and T4 and TRAB, that is thyroid receptor antibody test, is positive. Pancreas, the insulin is produced by pancreas, and the deficiency of insulin causes diabetes mellitus. So diabetes mellitus is a group of metabolic disease in which there are high blood sugar levels over a prolonged period. So diabetes is due to either pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. So the classification of diabetes mellitus, the types are type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes. That means the diabetes is seen only in the pregnancy. Now we will see role of insulin. So insulin usually balances blood sugar level in the body. So how it happens? So it inhibits the breakdown of glycogen, that is glycogenolysis. It inhibits the process of gluconeogenesis, that is production of glucose from other non-carbohydrate sources like fats and proteins. It stimulates the transport of glucose into muscle cells. Then it stimulates the storage of glucose in form of glycogen, that is glycogenesis. So in this way insulin helps to balance the blood sugar level in the blood. Now we will see types of diabetes mellitus. So there are two mainly, type 1 diabetes and type 2 diabetes. So type 1 diabetes, it results from the pancreas failure to produce enough insulin, and it was previously called as insulin dependent diabetes mellitus or juvenile diabetes because it is seen in mainly children. And type 1 diabetes mellitus is characterized by loss of insulin producing beta cells of the islets of Langerhans in pancreas, and which give rise to insulin deficiency. Type 2 diabetes is insulin resistance, a condition in which cells fail to respond to insulin properly. So this form previously called as non-insulin dependent diabetes mellitus or adult onset diabetes. The most common cause of the type 2 diabetes is in adults because of the excessive body weight and not enough exercise. So obesity, which is body mass index more than 30, lack of physical activity, poor diet, stress and urbanization. And dietary factors like consumption of sugar or sweet drinks in excess or fat, So saturated fats and trans fatty acids increases the risk, and polyunsaturated and monounsaturated fat decreases the risk of diabetes. Eating lots of white rice also increases the risk of diabetes mellitus, that is type 2. In diabetes mellitus, the patient gives symptoms of polyphagia, that is increased craving for the food, then polydipsia, that is increased thirst for the water, and polyuria, so increased frequency of the urination. And patient also gets the symptoms of weakness, tingling and numbness in the limbs. And if the diabetes is not controlled, then complications of diabetes may be neuropathy, that is involvement of the nerves, then retinopathy, involvement of the eyes, nephropathy, involvement of the kidneys, then heart, so there can be atherosclerosis or myocardial infarction. And then because of the accumulation of the ketones, patient may get diabetic ketoacidosis or diabetic coma. So these are the complications of the uncontrolled diabetes. Adrenal gland. So first is the Addison disease. So this Addison disease is a syndrome in which it is due to the inadequate secretion of corticosteroid hormones and aldosterone by adrenal glands. So patient gets the symptoms of weakness, loss of energy, low blood pressure, dark pigmentation of the skin and irritability or low mood. Then the disease is curable by replacement of the hormone therapy. Adrenal gland. So oversecretion of the corticosteroid hormone by adrenal gland causes Cushing's syndrome, and it is because of the overstimulation of the adrenal glands by excessive amount of hormone, that is ACTH. So ACTH oversecretion, if it is because of the tumor of the pituitary gland, it is called as Cushing's disease, or it may be because of the malignant tumor in the lung or elsewhere. The symptoms of the Cushing's syndrome: rapid weight gain, moodiness, irritability, depression, muscle bone weakness, memory and attention dysfunction, osteoporosis, diabetes mellitus, hypertension, sleep disturbances, menstrual disorders in females like amenorrhea or infertility. In men, it may be impotence, hirsutism, baldness. Hirsutism means abnormal or excessive hair growth pattern at the abnormal sites, and baldness means no growth of the hair. So to summarize applied endocrinology, pituitary gland produces growth hormone. The decreased level causes dwarfism or stunted growth, and increased level in the childhood causes giantism. In adult it causes acromegaly, and the deficiency of ADH causes diabetes insipidus. Pineal gland secretes the melatonin. Thyroid gland hormone T3 and T4 deficiency causes hypothyroidism. In infancy it causes cretinism. In adults it causes myxedema. And increased level of T3 T4 causes hyperthyroidism. And autoimmune disorder, the toxic level causes thyrotoxicosis or Graves' disease. The second hormone secreted by thyroid gland is calcitonin. Parathyroid gland secretes parathormone, and decreased level causes hypocalcemia. Increased level of parathormone causes hypercalcemia. Thymus, the hormone is thymosin. Pancreas, the first hormone is insulin, so decreased level causes diabetes mellitus. The second hormone is glucagon. Adrenal gland, also called as suprarenal gland. So adrenal cortex secretes aldosterone, cortisol and androgen. The decreased level of corticoid hormones causes Addison's disease, and increased level of the corticoid hormones causes Cushing's syndrome. Medulla secretes epinephrine and norepinephrine. Testes, the hormone is testosterone. Ovary, the hormone is estrogen and progesterone. Hope you find this session useful for your understanding and for your exams. Thank you.